Hi, my name is Dr. Danielle Crane. I'm a clinical psychologist, and in this video I'll be explaining a bit about how psychologists make sense of your difficulties. So you've probably heard the term diagnosis, which is where you are given a name for your particular difficulties, and that's really useful in some ways in terms of it's a really quick way of communicating a collection of symptoms. And we do use diagnosis to a certain extent. However, in psychology, we tend to focus more on something called formulation, which is where we are making a map or summary of your difficulties in a way that is much more specific to you and tailored to your presentation. So we'll be looking at the things that have contributed to your difficulties, the things that keep those difficulties going, what things are kind of helpful and that sort of thing. It requires us to gather a lot of information about you to make that a really tailored formulation. And I'll go through an example one just to give you an idea of what they look like. But there are lots and lots of different types for different therapies. So the formulation that I'll be talking about is from cognitive behavior therapy, which is also known as CBT. We tend to start with thinking a bit about any relevant previous experiences. So for example, if the person's struggling with feeling like they're not good enough, it might be that they've had previous experiences of being dismissed by their parents, or maybe they had very high achieving parents and they didn't feel that they were able to achieve those same standards. It might be that they were bullied at school. There might be a particular remark that a teacher made about them. It might be that they didn't have many friends or they were kind of excluded from social things. It might be, that they were in an abusive relationship and they were repeatedly told, that everything was their fault and everything they did was wrong. So there's loads of different previous experiences that can contribute to those particular difficulties. Sometimes we will go into more detail with that in terms of identifying the person's core beliefs that they might have, which are really strongly held internal beliefs that you have about yourself, the world and others. So you might believe that you are unlovable, or you are worthless, or you are a failure. You might have beliefs about others in terms of others can't be trusted or others are dangerous. You might have beliefs about the world in terms of the world is unpredictable. So those are really strongly held beliefs that you have that you might not be kind of fully aware of, but they do influence the way that you respond to things. Those things influence what we call our underlying assumptions, which are the kind of rules that we have for ourselves. So we call them if-then statements usually, because that tends to be how they're phrased. So if I don't achieve 100%, then I am a failure. Or if my boyfriend doesn't respond to my text straight away, then it means that he's about to leave me. That, we'll have loads of things like that that might come up in our day-to-day life that are rules and assumptions that we live by. And then on a kind of more surface level, we will have our automatic thoughts. And the ones that we tend to focus on in therapy are generally our negative automatic thoughts. So these are thoughts that pop up into your head at any moment during the day, and they're generally influenced by your underlying assumptions and your core beliefs. So those are kind of the three levels that we tend to look at in cognitive behavior therapy if we're going into things in more detail. But you might find that they start with just a really simple hot cross bun formulation where it's focused more on day-to-day situations. So they might acknowledge the previous experiences that you've had that have contributed to how you're feeling, but they'll be focusing particularly on the times when those thoughts are being triggered during the day. So you might pick a situation where you have got 80% on a test, and that might be the situation that we're looking at. We generally ask the person to pick a recent situation that's come up, because it's easier to then explore that in detail. They're more likely to remember exactly what has happened. And sometimes we get them to keep a record during the week of what's come up as a way of helping us to have those conversations in session. So once you've got your situation, we'd then be thinking about generally what thoughts came up in response to that. So a lot of the time people think that that situation caused the anxiety or the depression or whatever emotion it was that they were feeling. And we want people to start to realise that actually it's not the situation itself, but it's your thought or judgment about the situation. So the example I usually give is if you're walking down the street and someone is looking at you, you could have the thought of, they think I'm ugly, they're judging me, they think my dress is too tight or whatever. And if you have those thoughts, then you're likely to feel embarrassed or upset and want to kind of avoid that person or avoid that situation. Whereas if you're in the exact same situation of someone looking at you in the street, if your thought and assumption is, oh, they really like the dress that I'm wearing, or oh, they're being friendly, if you have those kinds of thoughts, then you're going to have a completely different emotional response. You're likely to feel proud or happy or more likely to go out. So it's not the situation of the person looking at you that is triggering the emotion, it's your judgment or your thought about the situation. So we want to capture those thoughts as much as we can. That's sort of the start of the formulation, and we will then be thinking about the other parts of what we call the hot cross bun. So you've got your thoughts, your emotions, your physical sensations, and your behaviour. And we draw them so that all of them are connected to one another, and that is because all of them influence one another. So if you change your behaviour, that will affect your mood and your thoughts. Equally, if you change your thoughts, that will affect your mood and behaviour. So we can target any point on that formulation to try and make changes in your life. So with the example that we're going through, they might have thoughts about that they're a failure, that they're not good enough, they'll never achieve anything, that everyone's going to laugh at them. They might have loads of thoughts like that. And we can challenge those thoughts to a certain extent in terms of getting the person to think about evidence for or against that belief. So if they believe that they've failed everything, you might get them to kind of look, actually, is that accurate? And it might be that actually they've passed most of their tests, there's just 2 where they've struggled with. Or we might get them to think about, okay, what would other people say about you? If I asked your teacher, would they describe you as a failure? So we try and gather evidence for or against to get the person to realise maybe my thought isn't as accurate as I thought it was. We can also identify what we call sort of mind traps. So these are kind of biases or inaccuracies in the way that we tend to think. So it might be that you are prone to catastrophizing or overgeneralizing or kind of predicting the future or only focusing on the negatives. There are loads of different ways in which we can be a little bit biased in terms of how we're looking at things. So saying that, oh, I'm never going to achieve anything because you've kind of failed one test, that would be an example of perhaps catastrophizing or trying to predict the future, and actually, that's not necessarily accurate. So we would want the person to start to notice, oh, actually, maybe I have a tendency to catastrophize, and then they can notice that in future and try and challenge it a bit. So that's looking at the thoughts on the formulation. When we kind of then think about the effect that those thoughts have on our emotions, it might be that the person identifies low mood or anxiety or shame. We can experience a whole load of different emotions at once. It doesn't have to be one emotion. And then we'll be thinking about the physical sensations that brings up. So, for example, if you're anxious, you would tend to find that you're breathing faster than normal, or your heart feels like it's pounding, or you're getting sweaty, or it's hard to sit still, you feel really tense. There's loads of different ways that our body sort of responds to anxiety. If you're feeling depressed, usually you're feeling really heavy, you're kind of lacking energy. And if you change those physical sensations, sometimes it can change your emotions. So that's why we get people to do breathing exercises when they're anxious, because if you slow down your breathing, that can communicate to your body that actually it can relax. So, or if you're feeling really, really hot in response to an emotion like anger or anxiety, then cooling yourself down can also reduce that emotion. So there's loads of different ways that actually changing your physical sensations can help with emotions. Another one is progressive muscle relaxation. If you're feeling tense, then being able to kind of relax each of those muscles is a really great way to reduce the intensity of that emotion. Then we move round to behaviours. So that would be, generally with depression, you would be withdrawing from other people, you would be wanting to avoid doing things, staying in bed all day, not wanting to do hobbies or those sorts of things. That's the kind of typical presentation for depression. However, that is not how everyone responds to it. You can also have people who respond to depression by working excessively hard because they're wanting to constantly distract themselves from how they're feeling. So just because someone is high achieving or able to hold down a job or any of those things doesn't mean they're not depressed. Someone can, be smiling and seem okay because they're kind of masking it. Doesn't mean that they're not depressed. There's loads of different behaviours you might see. With anxiety, it's a lot of that is sort of avoidance. So you're avoiding the thing that's bringing up anxiety. If it's social anxiety, you're avoiding other people. If it's, anxiety about, in terms of a phobia, if you've got a phobia of spiders, you want to do everything possible to avoid spiders. So you might notice avoidance, most in terms of anxiety, or it might be that the person has started doing a lot of things to try and reassure themselves. They might ask for reassurance from others. It might be that they check things repeatedly. There's loads of different ways that people manage anxiety. With anger, it might be, shouting, slamming doors, becoming aggressive towards people. With shame, it might be kind of hiding away and avoiding talking to people or talking about what you were ashamed of. There's loads of different behaviours, and it will be different to each person, which is why the formulation is so useful in comparison to a diagnosis. A diagnosis is very much a checklist of, these are the common symptoms that we see, whereas with a formulation, it is these are the very particular thoughts and feelings and emotions and physical sensations that you are having in specific situations. So it's much more tailored to your difficulties. So once we've drawn out a formulation to notice the situations where you tend to have those thoughts, the emotions and physical sensations and behaviours that tend to happen as a result of those thoughts, and we can get you to sort of see exactly what is happening and the patterns that you're perhaps getting stuck in, then we can start to make changes. So as I mentioned before, you can challenge your thoughts. You can use ways to address your physical sensations. You can also work on changing the behaviour. So that's why sometimes if someone's depressed and stuck in bed, we might use something called behavioural activation to help them increase their activity levels, because that will in turn improve their mood. Or if someone is anxious and avoiding things, we might use graded exposure to help them to gradually face that thing that they're afraid of, so that they can realise that, oh, actually it's not as dangerous as I thought it was. So there are ways that sometimes changing your behaviour can change your mood. So an example that you can try yourself is that if you were ever feeling really kind of lacking in confidence, maybe about to go into a meeting or that sort of thing, if you change your kind of posture in terms of sitting up and having your shoulders back and your head up, and taking a deep breath, even just changing your posture in that way can change your mood and your level of confidence and that sort of thing. So that's a really quick overview of cognitive behaviour therapy, formulation. As I said, there are lots of different forms of formulation, so I will try and make some other videos on those in future. I also might make a video about a formulation example where we pick a fictional character, so Cinderella or Harry Potter or that sort of thing, just so that you can perhaps have a go at thinking about what might go in each of those boxes on the formulation. And yeah, I hope that's been helpful. The other thing to note is that formulations should be done collaboratively with you if you are the client. So it's not a case of the psychologist says, oh, this is what is going on for you. It's a case of you two figuring out together and noticing things together. And often the therapist, if you're doing this in person, will get you to write it out. They'll kind of give you the sheet and you can put in your own words, what that sensation feels like, or you know, what that thought is that you're experiencing. So it should be done collaboratively so that you're both in agreement and you have a shared understanding of what it is that's coming up for you, before you then plan, okay, how are we going to address that? What things can we focus on in therapy to get you out of the cycle that you're in? So yeah, that's been a really quick overview. I hope it's been helpful. I've got to go prepare for some clients, but I will try and make some more videos soon. Thank you.